Hi, I'm Dr. Amy Overlin, sports medicine physician for Banner, and I'm here today to talk about post-COVID-19 infection and return to play protocol in athletes. So, if you do have a COVID-19 infection, which many people obviously have had over the last year, you do have an increased risk for something called myocarditis. And simply put, myocarditis is inflammation of the heart. And inflammation of the heart can cause sudden cardiac death in athletes, especially higher intensity athletes. So we have developed this return to play protocol and workup to make sure that our athletes are safe when they get back on the field. So most people who have had COVID-19 infection fall into three categories. The first category is those people who have asymptomatic infections, meaning that they were diagnosed with COVID-19, usually through a test, but they never developed symptoms. Also within that category are athletes who have less than 3 days of symptoms. So you may have some light congestion, a sore throat, even a fever less than 2 days, but you recovered really quickly and felt pretty normal after the first couple days. Those first people in that category don't need further workup and could benefit from seeing their physician, but don't have to. What they really need to engage in is a 5-day return to play protocol. This will include a progressive challenge of the aerobics system, meaning we challenge your heart each day a little more aggressively and make sure you don't develop any concerning symptoms like chest pain or shortness of breath. The second category, which is where most people fall into, is those that have more than 3 days of symptoms, but were not hospitalized. This is what we consider the moderate category. If you fall into the moderate category and you're 10 years old or less, or you're going to do a very light aerobic sport, so those are things like billiards, archery, or bowling, then you don't need further workup and you can just perform a 5-day return to play protocol and watch for those same symptoms we talked about. If you have any symptoms, obviously you would want to follow up with a physician. Now, those people that fall into that moderate category that are going to return to moderate to high intensity athletics, so that's all our competitive club sports, our competitive high school sports, even adults who are going to engage in, say, a running program or triathlon, they would fall into this moderate category. They should, one, see a physician and get a physical exam, and during that time, get some additional blood workup and diagnostic tests that can be done in the office to rule out or help rule out myocarditis. If all that is normal, then they can begin their 5-day return to play progression and then fully return to their sporting activities. Now, if those tests are abnormal, then the next step is to see a cardiologist and perform further workup to either confirm or again refute the diagnosis of myocarditis. If myocarditis is confirmed, then you would be managed by a cardiologist and eventually be safely returned to play. The last category is those who have severe COVID-19 illness. And that severe category is individuals who were hospitalized during their COVID management or have had multi-system inflammatory problems. Most of these people, though, will already be hooked in with a cardiologist because of their hospitalization. And further management should really be through that cardiologist before they could safely return to the playing field. A lot of athletes are anxious to get back on the field as fast as possible. And as a sports medicine physician, we really want to support our athletes in getting back on the field quickly, but also important to do it safely. And so when I talk to my athletes, I always tell them, I can negotiate with you about your ankle sprain for your return to play. But there are two things I will not negotiate with you, and that's your head and your heart.